I'm going to open the floor to the public to ask questions, to come to the mic, and please clarify who you're directing your questions to. And if you have any questions for Bill, you'll come up and... Thanks, Bill.
Terry Mullen. I'm a hospital worker, 28 years. I don't really have a question, I just have a few points I'd like to make. I heard the announcement on the radio today from Robert Travers accusing the union and Bill Fraser of fear-mongering and spreading rumors. To that, I'd like to say, we heard the same statement in August. When all this started, the Honorable, and I use that term loosely, Madame Dubé, said that we were spreading rumors about cuts. August 31st, I have a memo to all staff of Horizon. A number of false rumors are circulating in Miramichi. She goes on to say, no positions in Miramichi are being affected by these changes. Since then, we've had layoffs. We've had 9 people displaced out of their positions. And the ALC, you don't have to be a rocket scientist to figure out when you go to ALC units, you do not need as many registered nurses as you need, as are there now. Nursing positions are going to be cut. They can say what they want, they can call us liars. We know the truth. We're on the front lines. We're not sitting in an office avoiding phone calls. Many people have been trying to make this an issue of division. Union versus management, employee versus management, English versus French, a number of different issues. It's not a division of any kind, it's our hospital. It's everyone in this room that's going to suffer. Your parents are going to suffer, your grandparents are going to suffer. And one thing that really upsets me, Robert Travers did agree to come here. I was part of this organizing committee. Also, as Kelly stated earlier, Don Peters, the CEO of Horizon, said if he could not be here tonight, he would have someone here. Again, nobody was here from Horizon. So people can accuse us of being liars, but I think we proved tonight who is. And in closing, I just wanted to make one more statement. Like I said, I've been a hospital employee for 28 years. When I first started years ago, I believe it was 87 or 88, we had some sort of cuts going on. And the one thing that differs from then till now is when the government of the day was going to cut at your hospital, everybody from the CEO down to maintenance was out fighting with you. Nowhere in the last month have I heard anyone from corporate office at Horizon defending our staff, our work, or fighting to keep what we have. They're all yes men, and it's about time they stood up for us.
My name is Betty Karen, and I live in the seniors complex, senior apartment. And I'm 70 years old, and as I look around here tonight, I'm not alone, and there's a lot even older, when I dare say that. Don't hit me. But I have friends in Moncton, and on St. George Street, there's a beautiful complex, and many of you know all about it. And they have a level care, 2 different level cares in there besides in this big building that has, what, 325 apartments or something? And they also have those that need a little help. They're in a different little section there. And also then those that need full care. And I look at that and I think, why can't we have that? We're as important as the next person. And if I should live long enough, and God knows that, but if I needed to go into a nursing home, I don't want to be stuck in the hospital for a year or more waiting. I want to be someplace that's
Betty, what she was talking about is very important because that's the Shannick's concept of multidisciplinary care, which is a nursing home where it's level 3, and then there's a level 2 part where they need some care, and then level 1 where there's independent living. And actually those are I believe, I may be wrong, but I believe that the 3 nursing homes that were built in Moncton, Fredericton, and St. John had that concept. So that is the trend, and that is the type of situation that we deserve here in the Miramichi. Instead of the Mount, which was originally built by the nuns and with good concept, but it's more of an institutional type of building. We need a modern building that's going to be ready for all of us who are looking for a nursing home 10 and 15 years from now.
Go ahead, on the floor.
Thank you, Kelly. My name is Norma Robinson. I am the president of the Miramichi Council of Hospital Unions. I represent the QP workers here at the Miramichi City Hospital as well as all other hospitals in the province. I want to give you a little bit of history as to some of the meetings that I've attended with this government in hiding. This government has come out. Back about 4 years ago, I attended a meeting when the new structure of Horizon Health Network and Vitality and Facilicorp, Ambulance New Brunswick, and the New Brunswick Health Council was put into place. Back in those days, 4 years ago, we had a different government in place. We were told at that time there would be 5 regional health centers in the province. Well, that never came to be. Now, here we are in 2011, and we are again fighting for our regional status of hospitals. We deserve to have hospitals in this province to look after citizens in every area. We deserve to have this hospital in Miramichi to be able to serve the folks in Miramichi the way they deserve to be served. I'm not so sure when the people in Fredericton, and I'm still trying to figure out who they are because the only person I see now is Higgs, is what is this going to cause to people living in the Miramichi area? Does it mean that you're going to have to travel long distance? We have a number of seniors in this room tonight that may not have transportation. They may not have family to take them. They're going to end up having to hire somebody to get them down the highway. Because we don't have, let's not forget, we don't have enough ambulances and paramedics in the province to be used as a taxi service. What they've already done in Horizon Health Network is they've cut $4.2 million. We were told in July, at the end of July I was told, there was $14 million to cut. There's $9.8 million more to go. Where is it going to come from? What are they going to cut? What services are we going to lose in Horizon Health? I'm giving you this information tonight because I really want to piss off and get you riled up for the 23rd of November. Because on the 23rd of November, we need to go to Fredericton and we need to show this government who owns the Miramichi City Hospital. Who owns the services. And I agree with the gentleman that spoke before me. It doesn't matter who is there. We pay them. We pay them, we elect them, we expect them to do what we want. We need them to provide the service. If we continue to be passive, to not show them who actually owns this province, who owns the hospitals, who owns government, if we don't soon show them, we're not going to have anything. They are going to continue to cut and cut until we have nothing. And your hospital will be nothing more than a rural hospital. And rural New Brunswick is already being cut. We don't need any more services lost. So please, I urge you and encourage you to be there on the 23rd to show who actually owns this province.